right, let's focus now on valvular heart disease. Before we focus on the valvular heart disease, we have to know all of our valves: the mitral valve, tricuspid valve, aortic valve, pulmonic valve. Now remember that blood is going to be brought in from the right atrium to the right ventricle, and it's going to pass the tricuspid valve. After that, the right ventricle is going to contract, push blood to your lungs, and it's going to pass the pulmonic valve. When it comes back to your heart, it's going to go into your left atrium, and it's going to pass the mitral valve. From there, it's going to go to your left ventricle. Your left ventricle is going to contract and push blood to your aorta, and it must pass the aortic valve. Okay. So in a valvular heart disease, you either have to worry about a stenosis or a narrowing or a constriction of these valves, or something like a regurgitation. Now that simply means an incomplete closure. Now if this valve or door doesn't completely close, then this allows for blood to come back up. Okay, so let's focus now on mitral valve stenosis, or a narrowing. Now, let's take this a step back. We talked about atherosclerosis, and in atherosclerosis, you have a narrowing of blood vessels. Now, also, we talked about how, because there is a narrowing of arteries, the heart has to push harder, has to work harder. So keep that in mind, because that's going to come into play here shortly. So, mitral valve stenosis. This is caused by, we just got done talking about rheumatic fever, rheumatic heart disease, and the effects of a strep infection if the patient doesn't completely finish their antibiotic therapy, or if they do not go to see the doctor and they let the strep infection get worse and worse and worse. So we talked about rheumatic heart disease. Well, one of the main causes for mitral valve stenosis is rheumatic heart disease. So it is very, very important for you to understand rheumatic heart disease. If it is not caused by rheumatic heart disease, it may be caused by some congenital anomaly, meaning they're born with it. So it could be a congenital mitral stenosis. Again, they're born with this problem. Mitral valve stenosis may also be caused by rheumatoid arthritis or systemic lupus erythematosus. Now we're going to talk about systemic lupus erythematosis in a later lecture, but again, systemic lupus, meaning your entire body can be affected. So again, it may affect or may cause mitral valve stenosis. So let's move on to our clinical manifestations. Number one, exertional dyspnea. So again, patient goes and tries to do something, exerts force, you're going to suffer from dyspnea. Fatigue, palpitations, atrial fibrillation. If you were to auscultate the heart, listen to the heart, you'd find a loud first heart sound followed by a pitch or rumbling diastolic heart murmur. Now we're going to talk about these here in a little bit. Hemoptysis, chest pain, emboli. Well, how do we get all of these? Okay, we talked about a stenosis. We're talking about mitral valve stenosis. So the mitral valve lies here on the left side of the heart. Okay, so there's going to be a narrowing. Now, because there's a narrowing, the right atrium is going to have to pump a little bit harder to push blood down into the left ventricle. Now, as a result of that, because the atrium has to contract harder, push harder, well, some of this blood will stay here. Now remember that blood is coming from the lungs, so this blood actually has a potential to get stuck back in the lungs. Okay? Now, so blood is accumulating here, blood is staying here, which means less blood is coming into the left ventricle. If less blood is coming into the left ventricle, less blood is going into the aorta, resulting in decreased cardiac output. If you have decreased cardiac output, decreased blood supply to muscles, you have fatigue. If you have this blood accumulating in the lungs, you'll have difficulty breathing, especially if you exert any type of force. Therefore, you'll have exertional dyspnea. Now, talked about chest pain. This also has to do with that decreased cardiac output. Talked about emboli. If blood is just pulling here, because again, this door isn't opening completely, or it is narrowed, it is constricted, blood is going to sit here, and that gives it a chance to clot. So now we have to worry about blood clots or emboli. If this goes up to the brain, it can cause a stroke. Again, the atrium is having to push harder, having to contract harder, which will result in atrial fibrillation. Okay, so that is mitral valve stenosis. Now, let's move to mitral valve regurgitation. We talked about how regurgitation is simply a backward flow of blood. In one case, there's a stricture, a stenosis, a narrowing. So again, blood is pulling back here because it's not able to come down because again of that stenosis. Well, in regurgitation, there is an incomplete closure here. So blood can come back up. So for example, well, again, there is an incomplete emptying of blood into the left ventricle. So keep that in mind, okay? Now, mitral valve regurgitation. This can be caused by a myocardial infarction. And again, we see rheumatic heart disease. So again, make sure that you inform the patient, educate the patient to please finish their antibiotic therapy if they have some type of strep infection, because again, we see how strep can cause a lot of complications if it is not treated appropriately. It can also be caused by mitral valve prolapse, and we'll talk about that next. Now again, in a mitral valve regurgitation, you have a backflow of blood. And again, this is due to an incomplete valve closure during systole, during a contraction. Because this door isn't closing completely, blood is going to come back up. Okay, blood is going to come back up here every time there's a contraction. Now, because fluid is coming back up, just like before, we're talking about stenosis again, blood is coming back up here. This blood again has the potential to go back into the lungs. Fluid accumulation in the lungs resulted in pulmonary edema, also in cardiogenic shock. We'll talk about cardiogenic shock in a different lecture. Okay, but again, cardiogenic shock, and same thing again, we have to worry about decreased cardiac output. Now, as a result of this decreased cardiac output, if you were to check the pulse, you'd find that it is a thready pulse. Now again, due to decreased cardiac output, you don't have enough blood supply to your extremities, to your skin. Therefore, you will have cool, clammy extremities. Maybe even a cyanotic color, cyanosis, a bluish discoloration, pale skin. Now, if this happens for a prolonged period of time, again, your heart, your left ventricle is going to try to supply the demand. It's going to try and pump more blood out. As a result, the left ventricle will begin to pump harder, trying to squeeze all the blood that it can out. Now, again, we talked about how the heart is a muscle. As a result of a lot of pumping, this ventricle will get larger over time, hypertrophy, increasing muscle size. But again, if the problem is not corrected, it will result in left ventricular failure. Again, your muscle can only work super hard for a certain amount of time before it gives up. Again, if the problem is not corrected, it will result in left ventricular failure. Again, that is going to further cause decreased cardiac output, resulting in weakness, in fatigue, difficulty breathing. Again, we talked about how you're going to have pulmonary congestion because that fluid is going to begin to accumulate in the lungs. Patient will begin to suffer symptoms of heart failure. We get to see some peripheral edema. Very important for you to remember for the Nclex exam. You'll actually hear a audible third heart sound. Okay, that is mitral valve regurgitation.